Um, Before you get into the active phase of death, you might notice some more restlessness, you might notice sleeping more, that the resident is not eating or drinking quite as much as they used to, that they might be pausing while they breathe. There might be significant periods where they don't breathe. They might say that they're dying, and you really ought to take that seriously if they do that. They may start swelling. When you start to reach the active stages of dying, they may go unconscious. They may go into a coma-like state, or they may have wild hallucinations and start acting out. That's a condition called terminal restlessness. The pauses tend to be much longer. Other variations in breathing would be that they're breathing very frequently, and then that tapers off to almost nothing, and then again a very frequent respiratory rate. You may hear the death rattle, which is secretions. You'll have increased secretions that they can't manage anymore, so every breath is going to have a rattle to it. That can be very upsetting to family members who don't understand what's going on. They may have, this is a bad term, the O sign, where their mouth is open all the time. They don't close their mouth, it's just open. That's a pretty strong sign that death is imminent. A person who wasn't incontinent before may become incontinent or will become incontinent, both of bowel and bladder. The urine, if there is any, there may be no urine output, or the urine output may be very different in color. It may be bloody, it could be very brown, but will most certainly change in color. And the vital signs will definitely change. Sometimes the heart will almost stop beating, will go down into the 20s and 30s. Sometimes it'll go way up there in the 150s and higher. The blood pressure will tend to drop, but not always, depends on the condition. But approaching death, if you're seeing systolic blood pressures at 70 or less, that's a strong sign that death will be coming soon. To look at the patient, other than the O sign and swelling, you might notice that their legs are becoming mottled, and their hands too. The extremities will change color. They tend to be bluish, called cyanotic. They tend to be cold. You may not feel a pulse in them anymore. If they're awake, they might say that they can't feel their arms and legs, but usually they're not awake at that point. And then lastly, they start getting rigid, but that, in my experience, tends to happen after death more than before. When death occurs, there should be no respirations. They should be non-responsive to touching, to yelling. You can look at their eyes, their pupils. When you flash a light in there, there should not be any reaction to those. If you listen to their heart, there should be no heartbeat. Those are the signs of that death has occurred.